inside their network with an HMO, you pay 100%. It's all or nothing. Okay? With the PPO, you have doctors who accept the plan, and that when they accept it, they're in or out of network. Okay, so if they're in network, you pay a lower cost. If they're out of network, you pay a higher cost. And if they don't take the plan, you're 100% what you pay. Okay? If my mother, my mother, remember, is a frequent flyer for medical care. Okay, lots of chronic health conditions. Okay? If she didn't have her supplement and just had Medicare and her drug plan, every time she goes to the doctor, she'd pay her copay. Would never end, right? No limit to what she'd spend in a year. Okay, good thing she has her supplement. With these plans, they have an out-of-pocket limit. Because you can't have the supplement, at least this is the most you're going to pay in a year. So they have that out-of-pocket maximum. That maximum varies on whether your providers are in and out of network. So if you move to an out-of-network provider, that out-of-pocket amount raises. And again, you can't have a supplement with these. Some of these plans do sell an extra insurance policy to cover hospitalization. So you may pay another $50, $100 a month to get the copay for your hospital paid. If you grab the other book in your packet that has the state of Iowa on the front, turn to page 22 and 23. I think that's it. Okay. These are the PPO plans available in Woodbury County. The one that has Iowa on the front. There it is right there. Your fingers are on it. 22 to 23. Okay. Cross off care improvements. That one's not available here. Just put an X through that one. Okay. So if we look at that Coventry Advantra plan, you can see the monthly premium is $0. Out-of-pocket maximum is how much? $3,300. Okay, that's the most you're going to pay in a year for any services for that Coventry Advantra. Okay? In network. If you go out of network, that goes up to $5,100. $51 for out of network. How much do you pay to go see the doctor with that plan?
$15 to $40.
15 to 40, depending on whether it's primary or a specialist. Now, if you have to have physical therapy or cardiac rehab, that's considered a specialist. Okay? So $15 for a primary care doctor, $40 for a specialist. In network. If you go out of network, that percentage goes to 30%. What was Medicare's copay for Part B? 20%. You're taking on a little more risk that if you get a doctor who's out of network, you're going to pay more for it. Emergency room visit, $65. Inpatient care, you have a copay per day. Once you get past 9 days, it goes down to $0, and then after a certain number of days, it goes back up with a daily copay. Okay. Medicare Advantage plan can throw in some additional benefits. Go down towards the bottom of the page. Notice they throw in one eye exam, a vision check. Medicare doesn't cover vision checks unless you have an eye disease. Okay, but just to check to see how well you're seeing, no, Medicare doesn't cover that. They also throw in a wellness benefit, health club membership over at Four Seasons. Okay, but you're taking on more risk. To go over that Humana one on, well, both of those on page 23. Both of those are available in Woodbury County. Difference between the two is cost. One is $0, one is $30. The one that is $0 has no drug coverage. Okay. The one that has the $30 covers the drugs. How much is the out-of-pocket maximum for that one? $4,000. Goes up to $6,000 out of network. $6,000 out of network. How much do you pay to see the doctor with that one? 10 and 40, depending on what kind of doctor. Again, 30% out of network. Now, these are annual plans. They can change the rules every year. This Humana plan last year didn't have a deductible. This year it added a deductible. How much, Harvey?
Well, I don't know what you're talking about. The part that I'm concerned about, and the reason I left Humana is what they put in new is that they used to have a rate like $35 if you went to see a specialist out of the network. You gotta be real careful if it's in-network and out-network. What did they do this year? They put it 15%. Well, isn't that scary? What if I go to the specialist and he charges $1,000? That means I gotta pay $150. Last year I paid $35, so that's what turned me off on Humana. This 15% out of network, to me, was scary.
Yeah, out of network, it actually goes up to 30%. It's higher than 15. They also threw on a $1,500 deductible this year. They didn't have a deductible last year.
And the reason they didn't have it last year was because they would pay a flat rate like $35.
That's right.
Now they don't. Now they go to percent, so they kind of covered you with that limit on that $1,500.
Yep, Harvey was this really strong believer in Medicare Advantage plans until last year. Okay, there was no way I could have talked him out of a Medicare Advantage plan previously. Okay, but they can change the rules. Okay, they're riskier that way, so you don't know what it is going to be from year to year. If you are healthy and you have a very strong family history of being healthy, you know, they may provide lots and lots of savings, but you also have to be prepared and have the savings tucked away in case you have those bad years.
What page are you on?
I'm on page 22 and 23.
If we were looking for the,
The two Humanas are here.
He talked about
Out of network are the, yeah, I have it in my head. You can find it on the Medicare site. You know, the sad thing is if I go to the Medicare site to print out the fine details, it prints out in a size 4 font. I kid you not. 11 pages of size 4. Medicare. Craziest thing. Okay? But we know those just from having worked with it. See, so, you know, lots of times the salespeople come in and say, hey, this is great. You're only going to pay $10 when you see a doctor. And they neglect to tell you that if your doctor's not in network, you're going to pay more for it. And there are some doctors who don't take these plans at all. You're going to pay 100% with them. So you have to be very careful with these plans, okay? And especially if you're a snowbird, because you're going to have to check not only here, but where you snowbird, okay? So.
No, I think I'm suffering from a certain amount of confusion about this. We're looking now at, for example, you were talking about the Humana plan, and I presume these are the same plans that you told me about 20 minutes ago that we're marrying for the rest of our lives.
No, no, no. Let me go back. Remember I said there's two routes through Medicare. And that's where the terminology gets tricky. And that's where some of the agents can come in and confuse you. Because here, you're picking up that drug plan and adding a supplement. Okay? You're taking and adding those to your original Medicare, but you're keeping your red, white, and blue card and using that at the doctor. In this kind of option, you're going with a private company to do your Medicare instead. They're not supplementing your Medicare, they're taking over your Medicare.
Okay.
Okay? So these are annual. You want to if you choose to go this way, you want to review these annually to see if you want to stay with it or not. Now, the problem with that is, most of the time, let's say you keep that plan for 2, 3, 4, 5 years and you see that savings. Go back here a second. Okay? You see that savings. Okay? For 2, 3, 4, 5 years. Then you have that stroke. What don't you have to go back into a supplement? What have you lost? You know this. You know this. issuance. What did you lose? What was only in that short period of time?
Guaranteed. acceptance.
Guaranteed issuance. They don't have to take you if you've had this policy more than 1 year. We're going to talk about the test drive period exactly.
That's,
Doctor.
I want to be sure you stress
It's
that.
coming, it's coming, it's coming, okay? You have a special enrollment period for these. Remember I said you couldn't jump into a new drug plan until fall for next year? These, because you're losing your health benefit, you do have the option to move into one of these, okay? These have to take you unless you have that end-stage renal disease, okay? Even at the end next year, if you wanted to move into one of these, they have to take you anytime unless you have end-stage renal disease, okay? No penalty. Again, they're yearly contracts. They can change those plans on a yearly basis. Now, if one of those would go away, again, like anything else, if it goes away, you get a 63-day window of guaranteed issuance to move into a supplement. But it has to go away. Okay? And there have been some that have gone away since it started. We talked about HMOs, we talked about PPOs already. You do get a 1-year test drive with these. So if you want to try one out for a year, see how well it works, you can do it. And any time during that first year you pick it up, anytime during that 12 months, you can move back to original Medicare and a supplement and keep that guaranteed issuance for 63 days. So you still get that option if you want to try it. If you're healthy, this might be a really good option for you. If you go to the doctor often or have pending things sitting out there, it's probably not what you want. Okay?
I should add this. See, Monday I had someone call, wanted to go in bank plan. Okay? So I called Julie, at the ship office in Des Moines. And I was telling about this situation and some might be interested going because, so you have one-time try for a year. You go in bank plan for a year, try, you can go back to a supplement. But what she was saying in our situation, what she said was this. She recommended that you get your supplement for 6 months, she told me. And then if you want to try your Advantage plan, and the reason she said you want to do that is because you can always go back to your old plan, okay? But if you do that now, you have no old plan to go back to. So I don't know, does that make sense? She recommended, Chris, you know better, she recommended that they would go into a supplement so that after the year they could go back. I don't know, that's what she said. Does that make sense to you?
It does to me. We'll go by there. That's my favorite game is Stump the Ship Office. So I called them on this one because I didn't know if you had guaranteed issuance on it. So I called down and double checked on that. So yeah, it'd probably be wise if you're thinking one way or the other to start with the supplement, give this a try, then move back if you decide you don't like it. Okay? Again, these have the same open enrollment period as Medicare drug plans. They also have an annual disenrollment period where you can get out of it in the spring, the early part of the year. Now, when you get out of it during the early part of the year, that doesn't give you guaranteed issuance unless that plan went away. Okay, so you only get that during those little short windows. There's a list of questions in your flyer there, on your slide page. If you're considering a Medicare Advantage plan, one of the very first things you should do is call around to all your providers. Make sure they take the Advantage plan, and then you're going to ask if they're in or out of network. So if you're thinking that's an option for you, make sure you're asking those questions. There is a nice chart on the back of that booklet. Looks like that. We kind of put down how many times you see the doctor, what you expect your expenses to be, and you can compare those plans.
And also you have to check the county that you're in.
That's right, they're very regional. That's why I had you turn to page 22 and 23 if you're in Woodbury County. Those are your choices. Other than the HMO, I don't recommend. Okay. Okay. I neglected to say during the Medicare supplement portion, the ones you marry, There are 2 Medicare select plans that have come down into Woodbury County since this was published. One is Sanford, one is Avera. Okay? With a select plan, they give you a very discounted rate, but they limit your hospital choice. So with the Avera, you have to go to Mercy. You can go to any doctor you want, but if your doctor is going to come see you at Mercy, he has to have privileges at Mercy, or you have to be willing to take another doctor he recommends or is working at Mercy. Okay? Very discounted. If you move outside the area, so down the road you move to Seattle where my son lives and they don't have Mercy Hospital there that participates, it's just like your plan going away. It opens that little bit of window. Okay? But they limit the hospital network you can go to. No, this is a supplement, and very low cost supplement. So Avera and Sanford, we don't even, there's some rates in there for Sanford. In the book, they don't have our county listed. They just moved down this area, and Avera has just come in to Iowa. Okay, so that's a possibility. Okay, we'll do this really quick. I've got 3 minutes left. I'm not going to make it. If we run over a little bit, are you okay? If you need to leave, go ahead and do so. Medicare loses a lot of money every year to fraud and abuse. This is our S&P portion. In 2011, what Medicare could actually track that they lost to fraud and abuse was $34 billion. Huge drain on the system. We know if we can educate people to watch for fraud and abuse, we can get that money back into Medicare, keep it there, so those benefits will be there when I get it there, which isn't that much longer, unfortunately. Fortunately? I don't know. Fraud is intentional. It may have started as an accident. Maybe a billing clerk put in the wrong code. Maybe they put a sinus infection in as bronchitis, found out the doctor got paid better for bronchitis, and so they made a decision, from now on, all sinus infections are going in as bronchitis. They upcoded. Get paid better. Okay? It's an accident to begin with, but then it became intentional. There are actually companies that go around and teach medical providers how to upcode. Yes, really. It should be illegal. Abuse is typically substandard or unneeded items and procedures. Okay. Here's some examples. Billing for things you didn't get, being billed for times you weren't at the doctor's office. We had a guy over in the Quad Cities who read some things, found that the doctor did bill for one time he was there. He called the doctor to try to get that resolved. The doctor insisted he was there, the billing clerk insisted he had been there. He said, no, I wasn't, I keep records of this, reported to Medicare, found that doctor did that for multiple patients. Doctor's in jail, paying a fine, never doing Medicare again, all because somebody caught it and reported it. Okay? So you want to protect your cards and protect those numbers. There's people calling around right now trying to tell you we're going to reissue you a new Medicare card and we need to verify your number. Okay? So would you go get your Medicare card and pull it out and read me your number, please, so I can verify that? Would you do that for your bank account? No. They're also in those calls asking for bank account numbers. And if you get suspicious once you give it, because there's been some people who've given it, and as soon as it came out of their mouth, they're going, I don't think I should have done that. They keep you on the phone for a while, and they do charges to your debit or your account while they have you on the line before you can report it to your bank. So be very careful with your numbers. Watch for identity theft. You're going to know it when it happens with Medicare because you're going to see bills come or Medicare summary statements for places you've never been and procedures you've never had done. You're seeing those, someone's got your number. Medicare numbers are bought and sold on the black market. Seriously. Because they make millions off your numbers. Okay? Medicare's never going to call you. They're never going to call to verify that number. They're never going to come to your door. They're never going to come to your house to explain how the new Medicare summary notices look. Okay? They hire people like me to come out and do presentations. If you have a group you belong to that needs a presentation, on how to do this, or what to be watching for. I'm glad to come out and do that. Okay? Make decisions with your healthcare providers about what you need. My mother, again, I love her dearly, but she had the people who supplied her COPD, her nebulizer medicine, call and say, you haven't had this test done. We'll send out the equipment, we'll call your insurance, or we'll call the doctor, we'll get it all paid, and then your supplement will pay that, and you'll have no out-of-pocket cost. She's telling me this, and I'm going, Mom, did the doctor say you needed that? She says, well, the lady was really, really nice. They care about me. I said, Mom, that lady's paid to be nice. She's a salesperson. Did she have the test? Yes. Did she need it? I don't know, but that's a drain on our Medicare dollars. Know what your Medicare covers? Know if your doctor takes assignment. Again, that's going to save our dollars. I don't have any of these journals right now. We've got some on order, so if you want to come and get one, these are a great piece to keep track of your doctor's appointments, to write out questions ahead of time, to be able to track, and when you get your Medicare summary notices in, to compare to those Medicare summary notices. You can set up an account on Medicare.gov where you can pull up those Medicare summary notices before you get them. You get them quarterly. But how long do you know? How long can a doctor hold on to his bill before he sends it in? A year. And if there's a problem, 2 years. Now, I want to know who remembers what they had for lunch last Friday. Yeah, if you don't write it down, you're not going to remember when those Medicare summary notices come. And our booklets give you a place to write what you had done that day and to do that comparison. If you think there's a problem, call your doctor. Try to work it out like the man in the Quad Cities did. If you can't get resolution, get your documentation together and come and see me. I'd be glad to work through those. I have a couple cases right now I'm working on, just recovering $700 for a woman. Got her bills paid. Okay? It's free. Now, does this fraud happen in our area? Absolutely. When I have new beneficiaries, I talk about how to read a Medicare summary notice. Lady went home, saw at her mother-in-law's a Medicare statement, still on the envelope on the table. She said, Mom, can I open that up and read it for you? I never read those. What's wrong with that? Why is that wrong? Tell me. You guys know. She doesn't know what she's being charged for. What else may be wrong with it? Remember we talked about taking assignment and not taking assignment. What might be in there? There might be a check in there. And statements 4 years and older have your full Medicare number on them. So be careful with discarding
How long do
those.
we have to keep these statements?
Once you get it all resolved, I think you can let it go. And if you set up a My Medicare account, you can pull it back up there. Don't have to keep the paper. Okay? This lady opened up that statement from her mother-in-law, said, did you get something from that power chair company where you got your power chair, like a scooter chair, I don't know what brand it was, 5 years ago? Said, oh yeah, they sent me another one of those free gifts. She holds up a $5 fleece blanket that you could get one of the discount stores. You know, the ones I keep in the back of my car, those little cheapy things? Okay? They charged it to Medicare as an arthritis relief blanket. $957. I kid you not, I saw the bill. They've been charging those free gifts for 5 years. Did we report them? Yes. Okay? Durable medical equipment is one of the biggest areas of Medicare fraud. Okay, dates for you to remember. Okay? Your insurance ends on just June 30th. You want to have, if you're going to go into a Medicare Advantage plan, that decision made by the end of August. Okay? By September, your supplement's got to be in place. You'll probably ideally want it to start on July 1st. Okay? Then come fall, you're going to come and see us. We're going to take a look at your drug plans. Okay? And then if you want to get out of the Medicare Advantage plan, that's the annual disenrollment rate time. Questions? This is what we can do to help with our SHIP office. We do that presentation once a month. I told you about that earlier. And we always need volunteers. So if this sounds like something interesting to you, and you think you can make a difference in people's lives, and you will, great volunteer opportunity. And Does a dental plan end as well, Stephanie?
We don't have a dental plan, so it's probably through the retired school association, and so that's not changing. So if they have that through them, it's not changing.
You have the Delta dental, no, it's not changing. Okay, that's it.
One other thing, we do have summary plan descriptions of your current insurance. So if you want something to take to your agent or whoever you're going to talk to, if you want something on what you currently have, the coverage you currently have, we have copies of those back there. And if you don't know which plan, I've got a listing and I can check for you.
Okay, thanks for coming.
I have one question.
Very good.
Thank you.
At what point in time will Obamacare supposedly go into effect?
It's already started.